Showcase, a place where you have the opportunity to get to know a few of our local merchants, along with the goods and services they provide. Now, here's the host of the Showcase, Kirk Keller.
Good morning and welcome to the Showcase. I'm your host, Kirk Keller. Now this morning, the new year has already kicked off, and one of our resolutions, I know my resolution, is to lose some inches. Last year I lost several inches, gained a few back, but now I'm going to lose some more. And I'm with Dr. Anna at Body Focus. Now Dr. Anna, we're getting ready to do a procedure here that is, I guess, a quick way to lose inches after that holiday feast we had. Is that correct?
Yes, it's right. We're going to be doing LipoTRON, lipoplasty, which is a radio frequency based fat melting.
Okay, so basically it's a system that Tanya, who's going to actually do the procedure, rubs across whatever area the patient is asked to lose inches in.
That's
right?
Correct. Yes, that's correct.
And it melts the fat inside you? Am I saying that right?
Yes, you're right. We're using radio frequency technology, which is the electrical energy.
Okay.
And it does melt the fat. It creates heat in the tissue, and the heat melts the fat. And the patient will get rid of it through natural means, through her lymphatic system.
Right. So does this system only work on the abdomen area?
Oh no, we can do any area which has fat, abdomen, legs.
So I could take care of some butte here, right?
Yes, you can.
Great. So the abdomen, the buttocks, the thighs, the
thighs, legs, it works on a deep fat and it works on a superficial fat as well as cellulite.
Okay.
And it also, because it's heating the tissue, it's heating the collagen, we can also tone and tighten the skin by stimulating collagen.
Really?
So we treat faces, yes.
Now, superficial fat, I'm not sure what superficial fat is.
There are three different...
Is that like the arm fat that's...
Well, yes, there are three different kinds of fat. One is a structural fat. That's the good fat, which you want to have. It's around your joints, protects them from trauma. It's around your internal organs, around your kidneys.
Too as well,
so
right?
that's the protective fat, yes.
Okay.
And then we have subcutaneous fat, which is located under the skin and is more typical for women. And we have also visceral fat, which is a fat around the organs, internal organs. And that's the dangerous fat. That increases the risk of your heart disease.
Okay.
And that's more typical for men.
Gotcha. Now, tell us the process. How did this patient get to this point?
Pat already had several treatments, and today is her maintenance session. She did have good results.
So she's already got down to this size, and then there's a maintenance program. Okay, got it. Okay.
We do 10 sessions once a week, and you can get rid of up to 10 pounds and 5 to 7 inches.
Wow.
And then it's good to shake the system once in a while. Every 3 to 4 months, do the maintenance session.
Okay, all right. So basically, the patient called, made an appointment. You guys assessed that she was a viable candidate.
Right.
That's right.
She comes in.
It's not good for everybody, is that right?
That's correct. We cannot do it on everybody because we use electrical energy. We don't want to treat patients who have implanted pacemakers or defibrillators. We don't want to set off those machines.
So it's wise to have this procedure done by a physician, which you are.
It has to be under physician's supervision.
Okay.
We talk to the patient, we assess her history, make sure she doesn't have any medical conditions which would interfere.
Okay. Did you encourage the patient to go on a diet first, a food diet first, or is this a procedure that we can just and go?
Well, diet always has to be there.
Okay.
We're melting fat, but if somebody goes home and gains this weight faster than we're able to melt, we won't see results.
Gotcha. So basically, this is kind of a kickoff because it really helps, because I'm going to point you out here in just a minute. It helped build your self-esteem, I guess, when you started seeing those inches melt away, to encourage you to go on that food diet.
Correct.
Is that, Did you do a food diet?
Yes. I mean, I watch what I eat.
Okay.
You know, but you get to a point where you look back with the fat still there. You can't get rid of the fat.
Right.
So this was a way to help break that down.
Now I know on a lot of food diets, say you are quite large, or for women that have had a baby and gained a lot of weight, you have those what are they called, stretch marks. You get stretch marks. But you said this system heats up the collagen?
Yes.
Does that help with the stretch marks?
Yes, it does.
Okay, how does that work? Does it make them disappear? How does that work?
It just improves their appearance. We see anywhere from 50 to 80% improvement in the stretch marks, yes. The electrical energy and creating the heat warms up fibroblasts. Those are the cells which produce your collagen, and it stimulates them to produce collagen. That's actually alone long process, so those results you will see about 2 months after you started the treatment, and then those results will keep on improving up to 6 months.
Wow.
Collagen grows slowly.
Scoot over, I'm joining you. I've already been sold. And we're not even done with the show yet. We're going to take a fast commercial break, but if I am sold, what's the phone number I need to call?
688-1900.
Give Body Focus a call. When we come back, Tanya is going to start the procedure on the patient so we can show you how you can lose inches here at Body Focus.